it didn't quite work that way. So let's start with a little quiet mindfulness. Let's just sit in our seats and slowly become aware of that breath. And as our chest rises and falls, let's appreciate this body that we have. Let's appreciate the knowledge that we have gained in this whole series around women's health, as well as the knowledge that we gain from sharing experiences. We can't always control everything in our lives or in our health, but we can be empowered with knowledge and support and community. So let's just take one last deep breath in and exhale out. And when you're ready, open your eyes and join me. Okay, osteoporosis, here we go. So this is what we're going to talk about. What is osteoporosis? Who's at risk? Some screenings, some preventions, and some questions, answers, and discussion. So let's get started. So I started out with a picture of what osteoporosis looks like. 10 million Americans are diagnosed with osteoporosis. 8 million of them are females. So 80% of osteoporosis is in females. There's lots of reasons for this. One, of course, is the most obvious, is that we have a slighter build. Our bones are smaller and slighter and thinner. So just think about if your bone is the overall structure of the building, let's say, the infrastructure, a 2x4 versus a 6x6 beam, which is going to be stronger, the 6x6 beam. So similarly, we don't have as strong a bones just by nature of the size and the girth. But in addition, with that lovely exiting or checking out of estrogen, we lose the ability to rebuild the bone. And so we are at greater risk. 50% of women that are over the age of 50 will break a bone related to osteoporosis. 50% of us. That's impressive, actually. That's really a high number. Our male counterpart is 25%, so 1 in 4 for males. So osteoporosis also affects males, but just not to the degree, right? And most osteoporosis is not even diagnosed until that bone fracture. And the degree of the osteoporosis, depending on if you've had a significant fall versus I just hit my wrist on the wall and it was insignificant and yet it created a fracture, obviously that's a more concerning. And we'll kind of get into that a little bit. But I love the picture because this is the healthy bone. Obviously, the pores are smaller, the infrastructure around it is thicker and more substantial compared to the osteoporotic bone. All right, so what is osteoporosis? It is a bone disease that develops when bone mineral density and bone mass decrease, or when the structure and the strength of the bone change. And it can lead to decreased bone strength, which can increase the risk of fractures or broken bones. Pretty straightforward, right? We have something that's not as dense and thick, it's obviously weaker. Osteopenia is a term used to describe low bone mass. So you can be diagnosed with osteopenia. It does not mean you're going to end up with osteoporosis. It is not necessarily a precursor. This is important to know because people may have a baseline DEXA scan or an evaluation that diagnoses, and they're diagnosed with osteopenia, and they start to get very concerned. It's a good heads up, but it does not mean you are going to end up with osteoporosis. Okay, when I say it's a good heads up, it's like a ding, 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 a little alarm that says, okay, I really do have to start thinking about all the things they tell me to do. This isn't just for other people now, it's for me, right? So who's at risk? Anyone over the age of 50, and especially women. Females, postmenopause with that lack of estrogen, people with a family history, your mother, your aunts, a sister, anyone in your immediate family tree. People are naturally thin or have smaller frames. As we said, it's just a smaller structure. And then smokers are also at an increased risk. And then here are some pre-existing conditions. If you're on diuretics, which are, things like Lasix for blood pressure or for heart-related diagnosis, that puts you at risk. Corticosteroids, which are medications that treat inflammation, not NSAIDs, not things like ibuprofen and Aleve, but things like prednisone, heavy-duty steroid use. It is a precursor or it is a risk factor. Medications used to treat seizures, bariatric surgery, proton pump inhibitors. Those are used for like gastric reflux, like so your omeprazole, any of your Zols, right? Your esomeprazole, any of those proton pump inhibitors that you use for GERD are also, and it's related to the inability to absorb the calcium. It's a calcium imbalance. So, and then anyone who's not getting enough calcium or vitamin D. So if you're vitamin D deficient, that's a situation. And as we get older, with the lack of estrogen, in addition to just the natural aging process, we have a decreased ability to absorb that calcium in our body. So, as Karen shared, going through the regimen of chemotherapy, that is also detrimental in our bone health, and the steroid use. Not getting enough physical exercise, and then alcohol, which would go in the smoking category too. More than 2 drinks per day is considered too much, or puts you in that risk factor. All right, so how do we diagnose it? There's really one diagnosis, and that is a DEXA scan. And that is an X-ray imaging that you have done. It takes about 10 minutes and it's absolutely painless. You lay on a table and they X-ray like from your upper chest to like maybe your knees, but it's really that pelvic region, and they take measurements and they look at they're able to identify with that X-ray your bone density. And that's how they diagnose it. Now, if you have a family history, this is a test that if you're curious about where you're at because you have a family history, or you had a hysterectomy prior to menopause or at about the same time as menopause, you kind of have to advocate for a DEXA scan. I advocated for one because I had a family history and I had a hysterectomy. And they're like, I don't know if you really need it. And I'm like, I think I do. So be your own advocate in this. It's not an expensive test, and it's not hard to get insurance to cover it. All they need to put on there is family history, or if you're concerned. I mean, if your mother and your aunts and everybody lived till 95 and they were out in the garden and they fell 17 times and nobody broke a bone, well, then it's probably not something that was in your family. But all I'm saying is sometimes they kind of like try to push you aside. If you really want it for that baseline, just advocate for yourself. The FRAX is a tool that was developed to estimate like your chance, given where your osteoporosis is. There's this whole clinical kind of like matrix thing that they fill out. And what that is, it allows them to estimate a possible fracture of the spine. The top places are that you see these osteoporotic fractures are hips, the spine, and wrist. So like, because you're falling, you jam that wrist, your hips, that femur bone is our largest, strongest bone, but it's also, and it also bears the most weight, and it, when it is compromised, it is more impactful. So there's always the story, like, did they fall and break their hip, or did they break their hip and fall? Did their hip just give out and then they fell? And, you know, a lot of times it was the hip just gave out, like something happened and that hip just kind of collapsed and then they fell. So it's not always the fall. Certainly falls are not anyone's friend, nor are they a good idea. So we are going to try to do everything we can do to prevent. So here are some of the treatments. Oh, there's the Prolia that you're taking. There you go, Karen. So here are the oral agents that you can take. Take those by mouth, and then these are the injections. And they're sub-Q injections. They're not a big long needle. They just go in under the skin. But you usually go to your doctors to get those, okay? And they've been proven pretty effective. But as Karen shared with us, it's not without some major planning around it because there's things that will inhibit your ability to get the next dose or continue on it. So these are all great conversations, and certainly people, not everybody automatically goes to these injections. These are people that are at higher risk because they have checked a lot of those high risk, and their DEXA scan has probably proven positive. Yeah, Karen's nodding. Thank you. And so what I want to focus on with a lot of these things, this is a lot of this is the aging process. And sometimes in an effort to treat more urgent issues, such as breast cancer, we are forced to take medications that will then accelerate the aging process in other parts of our bodies. We're not getting out of this thing alive, people. We are fighting Father Time, but we can approach it in a way of longevity. So what can we do to protect ourselves for the longest so that the quality of our life is at a high quality for as long as possible? I don't care to live to 90 if the last 15 years have no quality of life. I want to live to 85 with the highest quality of life and go to bed one night and not wake up. That's how I would like it to play out. If I could, you know, I've put in my request. I'm not sure it'll be received. So all that to say is we need an awareness of what's going on in our bodies, which is what we do in these monthly things. And then we need to force a sense of acceptance. Okay, there are some things these things are inevitable. My body will start to age. But then I would like to introduce agency. What is it that we can do to promote that longevity, to give us the highest quality for the longest time? And that's where your mindset comes in, and where your self-advocacy comes in, and where some discipline or some changed behaviors or a little bit of both come in. And so what I want to talk about a little bit is some things we can do to promote the best possible outcome. So diets and supplement, our nutrition intake and supplements. We need to acquire that data. We need to know what our family tree is, what our risk factors are, and, you know, what's my baseline. And then lastly, what are some things besides our nutrition I can do around osteoporosis? So this is, I brought back an old slide, vitamin D. You need vitamin D. It allows for that bone to regenerate. You know what, I skipped a part. I wanted to talk about our bones are living organisms. They are not these just hard structures inside of us. They are constantly breaking down and constantly rebuilding. It is a continual cycle of breakdown and rebuild, breakdown and rebuild. When we are teenagers or in major growth spurts, we're doing more rebuild than breaking down. So there's a lot of growth there. But as we age, that process slows and the rebuild isn't as good. And the rebuild isn't as good because we don't absorb calcium as well. We don't absorb vitamin D as well. So we need to really be vigilant about vitamin D and and calcium in our diet. and maybe even a supplement of them. And so we know that we need calcium for bone strength, but that vitamin D will escort that, help escort the absorption of the vitamin or of the calcium into the bones. So vitamin D and calcium, really important to make sure you're getting enough of them in your diet, and really important to have that conversation with your provider about how much you're getting and is it enough, and should you start supplements? Should you take a calcium supplement and a vitamin D supplement just to promote the optimal bone health? So that's one thing you can do, your nutrition, your diet. If you're a smoker, you can decrease your smoker. If you're a drinker, I suggest you decrease your drinking. Like anything you can do to promote better bone health. And then exercise. This is a huge one. Because if you, and the statistics show also along the way that if you have been exercising all along, you are starting that, it's almost like you're starting the game with better bones. If you have had a good, this talk would be really beneficial for 20 somethings, because if you are building your bones to their strongest in your 20s, 30s, then the osteoporosis will slowly affect. But if you don't do any of those things and you start with already bone structure, it's only going to get worse, if that makes sense. So it's really important to introduce, and there's no better time than today or tomorrow. Actually, it's kind of late for today, but if you haven't ever been an exercise person, it doesn't mean it's too late. It's absolutely not too late, because you're going to build that strength of your muscles. So strength training. I wish Steph were here, because she could really chip in on what we need to do. But weight training, resistance training, body weight, and those are declining. So some people get very intimidated by the whole weight. So going to the gym, lifting weights, if it's not been in your wheelhouse, it can be, you don't know what you're doing or how you're doing it. You can start with resistance training, and that would just be, you could use bands, anything that you have to push against. Even something as simple, and this will go into the body weight, is sitting at your desk and flexing your muscles really hard and count for 5 and then relax. That is strengthening your muscles, engaging those muscles to build them. With stronger muscles, they support the bones. So that is something we can do. And as long as we have enough protein in our diet, our muscles will continue to grow. They diminish as we age, of course, but not if we have enough protein intake and if we're doing proper weight training, okay? So I would love, in a perfect world, and we'll talk about this maybe in the discussion, to kind of convert this to group activity. Like, let's all go to the gym on a field trip, and Steph shows us how to do the weights. We'll table that for our discussion. Cardio, for bone health, weight-bearing activity that increases your heart rate. So the one thing that's probably not great is swimming. Not that it's bad, it just doesn't help with bone health, because there's no pressure on the bones. It's a phenomenal workout, and it's phenomenal for muscle growth and cardiac, but because you're in the water and there's that zero gravity and there's no impact, you need some impact for the bone and bone health in the osteoporosis world. So a hardcore walk where you're really walking along, not a nice little stroll where you're stopping to look at the robin or whatever. I'm talking like I am on a mission walk, okay? So a powerful walk is going to be good enough. And running, if you can still be running at 55, I'm totally jealous of you, but that's also like one of those impact sports. Your Zumbas, your dance classes, anywhere where you're upright and you're doing a little bit of that movement and you're bearing weight on your joints. This is all good for you. Stretching, super important. It elongates those muscle fibers. It's good for your muscle fibers. It helps build your muscles, and it helps with your joints. Healthy muscles help your joints. And then lastly, I threw this one in yoga because you need good balance as we age, and you need strong core. because that's going to help you in prevention of falls. So part of it is to just have strong bones, and part of it is going to be preventative. So I can't say enough about yoga. And if you can't go to yoga, just practice standing on one foot. You know, use the wall as a gauge. Use, you know, but work on your balance. It's really important, and a strong core with that. So your strength, in your strength training, you should be doing core exercises because that helps with your upper body. So these are things we can do, and some of them are in our wheelhouse and some of them are not. I encourage you to try to find something that could be in your wheelhouse and then introduce that step by step, small. I'm not asking you to tomorrow say, you know what, I'm running that marathon that I, you know, no, I'm asking you to walk more. I'm asking you to do some, if nothing more than a plank, because that's weight bearing, something that will engage those muscles. And then lastly, these are my references. So this one, this Bone Health and Osteoporosis, phenomenal website, super, really great website, lots of information, easy to understand. That's a gem. So use, you know, please go there and find any information. And that is it for osteoporosis. How are we on time? Okay, we're good. I am going to stop the recording.